Welcome to Moving Forward, sponsored by MPW Mocklink TV and Mocklink Internet, online at mpw.org. Each weekday morning, our local talk segment brings you the people who are helping move our community forward. Let's start the show.
Good morning, AM 860, FM 95.1, KWPC. I'm Jordan Davis. Thanks for joining us this morning for Moving Forward on this Monday, October 8th. We're excited to be able to kick this morning off with you. Only about 71 degrees, but it's going to get a little bit warmer here this morning. Should only be a couple of days of hot weather, then we're going to move back into that cool weather that we had been seeing. Once again, this is Moving Forward, brought to you by Muscatine Power and Water. Mocklink is always Muscatine's fastest internet, and gigabit speed is coming. Mocklink TV beats satellite and includes video and music streaming. New subscribers save big, even more when you bundle. Learn more at mpw.org. Again, I'm Jordan Davis. This is Moving Forward. And in the studio with me this morning, Jessica Whitman and Angie Verbeck from the Muscatine Radiology. How are you this morning?
Hi.
Good morning.
Good.
We're very excited to have you in. It's Breast Cancer Awareness Month, as many of you know. We've been talking about it just about last week. Here's it's only the 8th, but we also want to do a shout out for Carriage House Carpet One, Muscatine's flooring store for over 40 years here on KWPC. Again, it is Breast Cancer Awareness Month. We're joined by Muscatine Radiology. We're going to be talking a little bit about screenings this morning, right? And what all it is, because you guys offer exactly that.
Exactly, yeah. We're just here basically, Breast Cancer Awareness Month is a great month for everyone to kind of check themselves and say, hey, am I of age to get a mammogram? If you have any questions, it's a great time to ask. And, there's always the football players wear pink, and there's pink out games in the high schools. And it's just a great time to rally around people who are suffering from breast cancer, people who have survived breast cancer. It's a great time to remember people who have succumbed to breast cancer. And it's also a great time to think, hey, is it time for me to get in for a screening? So,
right.
Absolutely. And those screenings are important. And something that we'd mentioned, or that was mentioned to me multiple times last week, we had a couple folks in to talk about it from Unity Point and also from Gilda's Club, is knowing your normal was a key factor in catching those signs of breast cancer early.
Right. A lot of ladies have what's called fibrocystic tissue or lumpy breasts. And some people are are unused to doing self breast exams, or if they do and they're very lumpy, they say, I'm not going to find it anyway. And that's where what they were talking about. The more you're familiar with your breast tissue, if something does come up different, you're going to notice a difference.
Gotcha. And I'm sorry, go ahead.
Nope. I was going to say, so it is really important to do a self-breast exam every month. And that's starting, what do we usually say, at the age of
20.
Age of 20.
Mm-hmm.
And that way you do get to know what your normal is. And if you do see something different, then it's time to come in and talk to us. And
Right.
if you do find a lump, or if you're feeling a lump, or if you're feeling pain, then you kind of forego the screening and you're coming straight in for a diagnostic mammogram.
Right. And that's why we like you to start early with the breast exams. Unfortunately, we do have younger women that do end up with breast cancer. So just because you're under 40 doesn't mean that you can't get breast cancer.
Right.
Unfortunately, you can. And unfortunately, younger people that do get breast cancer, it's usually an aggressive breast cancer. So we definitely want to get you in.
Right. They say that estrogen is kind of like fuel to the fire for cancer. And that's why the younger you are, the more lethal it is. And I like to kind of tie that into some of the recommendations that people might be hearing, and why there is such a discourse on, the American Cancer Society versus the ACR. You find more breast cancers in women who are older, but the younger you are, the more aggressive the cancer is.
Correct.
So that's why we say every year starting at the age of 40.
Gotcha.
Unless you have a family history, mother or grandmother that had breast cancer. For example, if they had breast cancer at 45, your doctor's going to want you to come in at 35, 10 years prior to that diagnosis.
Gotcha. Because are there tell signs like to say, oh well, you're more at risk than someone else, even if it is just your genetic, like your mother, your grandmother had it, versus like actual show signs?
There are signs, and we want you in before those signs, because that definitely means
Gotcha.
that there's more an aggressive breast cancer going on. Unfortunately, in my 25 years of being a mammographer, I've seen, unfortunately, some very sad signs where patients might have been in denial. Some of the things that you can see are bloody discharge, if one breast looks different than the other, probably more like a shrinking versus one's larger than the other, which I guess that would make sense.
Yeah.
You can have what's called the orange peel effect, and it's just your skin looks different. You can also have, the pain, burning, redness. Sometimes that can be an infection, but it can be part of a breast cancer as well.
Gotcha.
One of the largest risk factors for breast cancer is simply just being a woman. So,
right.
And 75% of people or women who are diagnosed with breast cancer have no family history. So,
Really?
if you have, like Angie said, if you have a family history, it's so much more important to come in. But then again, if you don't have a family history, don't let that deter you, because 75% of women diagnosed.
We get a lot of ladies that say, I don't have a family history, so I'm fine. I don't even know why I'm here. But to be the bearer of bad news, someone's got to start the family history.
Yeah.
So obviously we don't want it to be you, but if it's going to be, we want to find it fast. So it's very, very curable if found early stages.
And that was the key that I kept hearing, was the earlier you catch it, the quicker treatments can start, the better success rate, right?
Yeah, early detection is your best protection, is
Right.
what we like to say.
They say by the time you feel a lump, it's been in your system for anywhere up to 8 years.
Really? Wow. That really surprises me. That is not at all what I would expect out of that.
And now there are aggressive cancers where, we've had patients come in and have a clear mammogram, and a month later, all of a sudden they have a lump. So just because you have a mammogram doesn't mean you're good to go for a year. Things can happen throughout that time, so that's why it's the importance of doing the breast exams as well.
Yeah, or like your other professional said, know you're normal, so you know when it's not.
Right. Well, that's really interesting. That number catches me by surprise, just because you see, like you said, it happened as early as a month later. Well, the more I hear when I hear about it, is it's like, well, they were clear, and then all of a sudden it's just like that. It was rampant. So wow. Well, what else is there to talk about here? So this is the month to be getting screenings. This is the month to be talking about it. This is the month to make sure that any family members that you have, if you've got daughters, wives, mothers, anything like that, be mentioning to them that it is the time. And it's not just for women. Guys too. What is it, like 1 in 1,000 guys are at risk for? I
believe that does sound good with this statistic.
Yeah.
We do not do men as far as screening. Men are considered diagnostic.
Right.
Mammograms, and it's obviously because they have a lump.
Gotcha.
Right. And we have had people give feedback before about Breast Cancer Awareness Month and saying, well, my brother or father passed away from breast cancer too, and so why is it all about women? But we don't men don't actively get annual screening mammograms. And like Angie said, by the time a man would feel a lump, he would be coming in for what we call a diagnostic.
Gotcha. Gotcha.
So a screening, I don't know if, Angie, if you want to explain the difference between the two.
It's pretty basic. Screening, no symptoms. Diagnostic, you're feeling something. Pain, discharge, lump. And when you have a diagnostic and you call us, it's a self-referral, a mammogram is, as long as you don't have Medicare. Meaning you can call us, schedule your own mammogram. The only thing we do need is a physician, so we can send the report to them. Other than that, it can all be done by yourself. You don't have to wait for
you don't have to go
Correct.
to another medical professional like the hospital or something.
Correct.
and then come to you guys.
Right.
You can go directly to you. Okay.
You don't need
we
an
do
order.
have a few physicians. I still believe we do have a couple physicians that like to see their patients prior to having the screening mammogram. But most of the physicians, even if you don't have an order, if you need an order, if you have Medicare, we're more than happy to get you scheduled, and then we'll take on the responsibility of getting the order for you. You don't have to worry about that.
But we do have to have an order for that diagnostic. So if you come in for your screening and we find something, or we want to take a closer look at something, that's when we have to make sure that your referring physician gives you an order for that.
Okay.
And we usually take care of that as well.
Gotcha.
Yeah.
Well, let's also talk a little bit about do you guys offer any educational stuff for folks if they come in, like if they come in for a screening for what do you guys have stuff that they can have so they can be better prepared, more knowledgeable on what they can be doing to actually prepare for or test themselves?
We do have a couple of brochures, and we have these little things called shower cards, which kind of walk you through a self-breast exam.
Okay.
Because a lot of ladies do the self-breast exam in the shower. It's easier with when you're wet and lathered up with soap, so
Gotcha.
your hand
And
glides
so-
a little bit easier.
So you do have educational material for
You
them
bet,
so that
you
they
bet.
know they can.
Sure.
It's kind of a walkthrough of
Yeah.
how you can do a self-check. Gotcha. Okay.
Right.
We
And
have
we're all
English and Spanish.
English and
versions.
Spanish, yeah. And we're always happy to answer any questions you might have before or after your exam. If you come in for a diagnostic mammogram, you'll actually have your results before you leave that day.
Wow.
The radiologist will actually come in and talk to you. And that's a really great time, too, to actually see the doctor face to face and just talk to him about maybe what you're nervous for. What does this mean? So I'm clear, but I'm not clear, or what's going
Right.
on. And so he'll let you know before you leave that day for a diagnostic.
Right.
Screenings, we usually get the results to you pretty quickly, and Ange, I believe, gives you the option for a phone call or a letter or both, whatever you prefer, because we know that.
Usually, no news is good news.
Yes.
So, but
Right.
some people, maybe they have a strong family history or a friend or something that had breast cancer and their anxiety level's a little high. It's easy for us to get that call out to them. So if you have your mammogram today, for example, it'll be read tomorrow, as long as we have your prior exams available for the radiologist.
And let's face it, anytime you're getting any type of or taking a test, having a test, like the anxiety of knowing the results
Right.
can be pretty high. I mean, I take a Facebook quiz and I'm like, what am I?
Right.
So you want to make sure that we want to make sure we get the results to you as quick as possible.
Yeah.
Gotcha. Well, anything else you guys really want to point out here during Breast Cancer Awareness Month?
I just think, and you've already mentioned it, Jordan, so thank you so much. Have a conversation with somebody. I'm not necessarily of age yet to have a mammogram, but I talk to my mom about it every October, and I say, Mom, it's time. You need to go have it done. And she gives me pushback every year, but, just so we have the conversation, it makes me feel good about it. It makes her feel good to know that someone's advocating for her. And you could talk somebody into a life-saving exam. So that's just what I like to tell everyone. This is the time to do it. Have that
Yeah.
conversation.
We have some ladies that do the buddy system. They come in with their friend and then go out to dinner or shopping or something. It's an annual thing for them. And I make sure I harass my coworkers. I'm like, you have to have it. You're due this month. We're doing it.
Excellent.
And we just want to let everybody know that as far as scheduling, like we said before, as long as you're not having any issues, you can give us a call. We can get you in. We do accept walk-ins. We're getting into our very busy season, not only in October, but November, December, especially the last week in December. So if you're due, give us a call.
Yeah.
Excellent.
But we always have frantic calls at the very end where people are with their insurance, their deductibles
gotcha,
have
yeah.
met,
Mhm.
and they want to get in.
Yeah.
So we're more than happy to get everybody in. And as long as you don't mind waiting, we'll get you in.
We'll get you in. Yep. A lot of times, same day, too. So.
Great. Well, excellent. Well, thank you so much, ladies, for joining us this morning.
Jordan. It's always nice to talk to you.
Absolutely, and it's always nice to get to talk to folks that are are knowledgeable in the field for stuff like this, especially during Breast Cancer Awareness Month. We want to do our best to get out information as well, and I don't know the first thing to talk about any of it, so I just want to. It's good to be able to bring folks in that do know all of this, so that we can kind of get information out there, so anybody that's listening can have that conversation or whatever it is.
Yep.
So
Well, it's a great thing you're doing for the community, just with all of the people you have come through here. So thank you for being such a great community advocate. We appreciate
well,
it.
thank you so. I really appreciate that.
Yeah.
Got me blushing over here. All right. Well, this is moving forward. Thank you so much to Jessica Whitman and Angie Verbeck joining us from Muscatine Radiology here for Moving Forward this morning. As always, brought to you by Muscatine Power and Water. Muscatine Power and Water. Mockling TV is the fastest internet, and gigabit speed is coming. Mockling TV beats satellite and includes video and music streaming. New subscribers save big, even more when you bundle. Learn more at mpw.org. Again, I'm Jordan Davis. This has been Moving Forward here on the voiceofmuscatine.com.